Phase 2 of COVID-19 vaccinations is underway in South Africa. The country has seen a gradual rise in new infections. There are over 55,000 deaths in the country so far, while 3,555 new cases have been reported. According to the Health Department, over 500,000 vaccines have been administered so far. Let's get more then from the Council for Scientific and Industrial Research's Dr. Ridwan Suleiman. Dr. Suleiman, good afternoon. Thank you for joining me as I ask the team to remove that backdrop behind me of India, because that is the story that we will go to next. It's not necessarily related to what we are talking about. So let's start, Dr. Suleiman. You track these numbers really closely, and from the numbers that you've been sharing, let's start with the average daily COVID-19 cases in South Africa. It seems we are on the rise, and we are somewhere between 5 and 10%. What does that mean?
Good afternoon to listeners. Indeed, we are seeing a sustained increase in most of the indicators and across all of the provinces. So if we look at daily cases, at the moment, the 7-day average of cases reported across the country is just over 2,700 new cases per day over the last week. And it is increasing quite sharply. That figure has shown an increase of 40% compared to just this time last week. When we scale that by the population size or look at the number of cases per 100,000 people, we see that across the country we're now seeing 5 new cases per 100,000 people per day. So starting to move towards concerning levels and increasing quite sharply, driven largely by the most populous province being Gauteng, but increases across all of the provinces of late.
So for comparison then, if we're talking about 5 positive cases per 100,000 people per day, how does that compare to where we were previously?
So if you look at the peak of the previous or second wave, that was at 33 new cases per 100,000 people per day across the country. So if we compare to that previous peak, we're up to about 15% of that. So while it may not seem as severe as what we saw at the peak, we need to bear in mind that we are on an increase, and it is rising, and we're starting to move towards concerning levels. We may not have passed the threshold to formally say that we're in a third wave just yet. That threshold currently is 30% of the previous peak. So while we're at 15% of that peak, I think we do need to bear in mind that the increase is now sustained across all of the province. Whether or not we're in a third wave just yet or not is probably a matter of semantics. The risk has certainly increased, and we're seeing it across all of the indicators. Test positivity rate confirms the increase. Yeah. Hospital admissions are also on the up too.
Dr. Suleiman, I'm going to ask that we bring up that last slide that we just showed now, because when I was looking at it, I was just, I was astounded by the graph, the way it rises. There you see it there. It's the daily incidence rates per province in South Africa. So you generated that. But the way that the graph rose sharply for the Northern Cape, my goodness, is it concerning. But also provinces like Gauteng as well, also showing a sharp rise in the number of cases.
Indeed. So the Northern Cape has been on a sustained increase since the Easter long weekend, and currently the case loading is at its highest point it's ever seen at any point in the pandemic. You'll see that that curve is higher than the previous 2 peaks. So currently Northern Cape is about 40% higher than its previous peak, and a case incidence of over 32 new cases per day per 100,000 people. So it certainly is a concern, and it's been on the rise since the Easter long weekend, and we really need to try and get on top of that and control that. You'll see that the Free State is also on a sustained increase, up about 15% compared to a week ago, and the Northwest is also up about 30% compared to a week ago. Those 3 provinces are formally in their third waves. But the other concern is the Gauteng. It's currently on the sharpest increase of all of the provinces. It's increased by about 66% compared to just a week ago. It means that new cases in Gauteng are doubling every 9 to 10 days. And currently the case loading within the province is about 20% of its previous peak. So certainly a concern because it is the most populous province. Infection rates can spread quite quickly in these densely populated areas. It's also contributing the largest proportion to new cases that we're seeing across the country. And being the economic and travel hub of the country, a lot of movement into and out of Gauteng. So what we're seeing here can easily spread and be replicated in neighboring and other provinces too.
Dr. Suleiman, again, I'm going to ask that we show that last slide that we just showed in a couple of moments ago, and it has to do with the test positivity rates per province. But I would want you to then speak beyond just the provinces, because when we were talking about 5 positive cases per 100,000 of the population, that's the virus in the community. This, on the other hand, talks to the virus in the laboratory. The higher numbers that we are recording are actually coming from a higher test rate. We are testing more and detecting more. Where do we stand in as far as the test positivity rate is concerned, and when do we really begin to worry?
Yes, this is a good point. The test positivity rate really is a good indication, confirming firstly the trend that we're seeing in infection rates. So nationally, that test positivity rate is up to 8.2%, and that has continued to increase for the last few weeks. It's up about 20% compared to a week ago. So while testing has increased across the country, testing is about 34,000 tests per day across the country, up about 20% compared to a week ago. The proportion of tests that are returning positive results has increased even further. So that test positivity rate has increased, confirming that the infection rate is real, and it's confirming the rise that we're seeing in the number of cases. What it means is that nationally we're finding a positive test for every 12 tests conducted. And as this positivity rate continues to increase, it will give an indication that there are many more undetected cases on the ground, and the number of reported cases is not necessarily a true reflection of the reality. If I go further and break that down per province, Northern Cape showing a test positivity rate in excess of 25%, meaning a positive test for every 4 tests conducted. No doubt many more undetected cases in that province. Free State and Northwest at around 15%, Mpumalanga moving up to 10%, and Gauteng at over 6% now, moving closer to 7 and 8%. So certainly the increase in this indicator confirming the increase in infection rates, and as you indicate, as this measure continues to move upwards, it will show that there are many more undetected cases outside of the laboratories, and the reality on the ground is possibly even worse than what we're reporting.
And what's the story in as far as hospital admissions and deaths are concerned, given the picture that you have painted so vividly for us over the last few minutes?
So unfortunately, we're starting to see an increase in hospital admissions across the country. Bear in mind that there is this lag period, generally between people being infected to confirming that via testing, and then being admitted to hospital. There's generally a 2 to 4 week lag, and then there's about a 3 to 5 week lag, unfortunately, when you start to see people succumbing to the virus and the death numbers starting to increase. Nationally, number of new hospital admissions are starting to show an increase. In fact, they've been increasing for about 2 to 3 weeks now. The previous week saw just about 2,500 new hospital admissions across the country, up 10% compared to the week prior. And if we look at the provinces that are contributing to that, the Free State new hospitalizations have been increasing for at least 5 weeks, in line with the increase in number of new cases that province has seen. But also new hospital admissions in Gauteng are up. Previous week were up 12% compared to the week prior. So certainly the rise in infection rates is translating now to bigger pressure and burden on hospitals and healthcare facilities. Other provinces are also starting to see more admissions in hospitals. Not quite at the same level we saw at the peak of the previous wave, but this is slowly moving upwards now.
Right.
In terms of deaths, unfortunately, we're starting to see more deaths being reported across the country, about 70 new deaths per day. Bear in mind that there is a backlog of deaths being reported in many of the provinces, but including Free State, Northwest and Gauteng. But generally, death trends are rising in Free State and Northern Cape in line with the increase in infection rates. The provinces such as Gauteng and Western Cape starting to reflect more deaths of late.
So these are obviously sobering statistics, Doc, and I imagine that you and the CSIR do all of this collation of this data for a purpose. Having gone through all these figures and graphs that we have shown that paint a picture over the last few minutes, what do you want someone who's reading the data that you put out, who's listening to you and I now, what should they be taking from all of this? And I suppose, how should they react to it?
Look, I think we need to use the data and use the trends in the data to understand how the virus is spreading and where the hotspots and areas most at risk are, and try and contain and mitigate that from further onward transmission. We've seen a sustained increase in provinces like Northern Cape and Free State since the Easter long weekend. I think if we can try and understand maybe one, what's causing this increase? Are there specific super spreader events and cluster outbreaks? Can we identify those? And if so, can we try and quickly trace contacts and identify and isolate positive contacts? We do know that super spreader events are really responsible for driving the rise in infections. So if we can possibly increase testing in those areas and then try and do efficient tracking and tracing and isolation of cases to prevent onward transmission in those areas of higher risk. I think we also need to understand that as the risk is increasing in most of the provinces, but in some areas at a higher rate than others, we do need to try and communicate that more and inform people that the risk is increasing, so behavior needs to be adjusted. And so we need to try and, I know we've been speaking a lot about non-pharmaceutical interventions, but it's becoming important to mitigate onward spread. Yeah. And then I think maybe a differentiated or phased approach to handle those regions that are showing the largest increase, and the data and trends are quite clear.
All right, thank you for your insights there. That's Dr. Ridwan Suleiman from the CSIR. There you saw for yourself, the picture is as clear as day from what Dr. Suleiman was painting there for us. Behavior adjustment. Don't wait until we are forced to lock down and we are forced into difficult situations. Take responsibility. The graph really is going up. It's no scare. It's real. The figures are real.